And the reason you get that barky cough is because all the inflammation is around those vocal cords. And so when you're trying to cough, you get that kind of barky seal or dog-like noise. And when you're trying to breathe in, if the inflammation is pretty severe, that's when you get the stridor noise, which is again the kind of noise on breathing in. If your child has stridor, you need to go to the ER immediately, but we're going to talk a little bit more about that in a second. So when you're looking at that inflammation in the airway, if you were to do an x-ray, you would get what is called a steeple sign, which means the airway is actually narrowed up like the steeple on a church, because that inflammation just kind of causes that to come to a tiny little point, which is why you get those noises. When we're thinking about how we're going to treat croup, the main treatment is going to be steroids. If you see your pediatrician, they're probably going to give you a 5-day course of steroids, like prednisone or prednisolone for a child who can't take pills. If you go to the ER, we're going to usually give you a medicine called Decadron, which is another steroid that's stronger, and they only need a one-time dose. So it's the same thing. It's a liquid medicine. The child drinks it, and it reduces the inflammation enough to carry them through the course of the illness so they don't have to take any more medicine. That's just if they're coughing. Now, if they have that stridor noise when they're agitated, that will watch them a little bit more closely.